Would you believe me if I told you that ankle range of motion, particularly ankle dorsiflexion, is the #1 cause of running related injuries? One culprit, two separate different causes. What is this motion? It's called ankle dorsiflexion. How we use it with running is the ability to get your knee past your toe, which causes this folding of the ankle. So we have what's called open chain. When the foot's off the ground, it lifts the ankle like a drawbridge. And closed chain, when the foot is on the ground and this bottom bone, the tibia, moving forward, or how we measure it is the knee going forward. So lack of this will absolutely change the way that you run. And I'm going to show you why and how this correlates to two separate causes of medial knee pain. So here's what you're going to do. You're going to see how far away from the wall can you go, keeping your foot straight, heel down, and tap the knee to the wall. Normal is considered about 4 to 5 inches away while keeping your heel down. I've shown that less than 1 inch of this test is going to affect your running mechanics. And this is how it happens. So when we're running, the ability to get the knee past the toe, see where and when this plays out. So as I'm going, after I land, as I go to that mid-stance position where I'm balanced on one leg, we're at our lowest center of mass, as my knee comes forward, if I don't have the range of motion in my ankle, what's going to happen? Just like failing the test, the heel comes up early. Not only does that cause lack of hip extension, but it causes less bending or flexion of your knee. So what tends to be loaded more is the joint, the medial part of your knee. But the second thing that can happen is something we haven't talked about yet. So your body's going to find a way to go forward. We have 3 planes of movement. Sagittal plane is this forward and back. If I don't have the range of motion in the sagittal, what my body is going to do is use the transverse plane and rotate. Watch the same distance that I failed before. I'm going to externally rotate my right leg, pointing my toe out. Now I can easily touch my knee to the wall. And what does that do? That causes torque or twisting on the inside part of your knee. The inside part of your knee doesn't like that. Our knee is meant to mainly act in this sagittal plane. It doesn't like that rotation. So we're going to get more forces on the inside of your knee, and I'll show you how that is. A sign that you also have been doing this, of pushing off like this, is you're pushing off towards the inside part of your foot and your toe. You'll see commonly a blister that's formed on the inside part of your big toe, or a callus. That's a sign that you may be doing this as a cause. How does this play out when we run? This is the position. You see how I landed with my toe facing out, and the reason that is what we talked about before. Now I'm going to be able to pass that test. But what happens when we do that force to the knee? Your meniscus, we've been talking about excess loading to the inside compartment of your knee, the joint space, the cartilage, but also your body is smart. It put what's called a meniscus sandwiched between the two bones and the cartilage. So it's bone, cartilage, meniscus, cartilage, bone. So your body puts the meniscus to help increase congruency of the joint, help to absorb shock even more. So these are 3 special tests that we have that have been researched with some validity and reliability to see if you have medial knee or medial meniscus pathology. There's different levels of accuracy. It's argued in the research, but how they find these out is they take, let's say, 1,000 people, and they have an MRI, which is considered the gold standard for picking up a meniscus tear. And then they have a test that they do on these 1,000 people that have knee pain. The clinician doesn't know if they actually have it or not. They rate them as positive or negative, and then they compare. How accurate are some of these tests? The main point of this to know, despite the accuracy or lack of accuracy of these tests, they all involve this torsion on the knee causing pain. So you can imagine if I'm doing this when I'm running, that's probably going to cause some irritation or torsion on the inside or medial part of your knee. So to summarize, we had 1 range of motion restriction, ankle dorsiflexion, causing 2 different ways that it can cause medial knee pain. 1 was an amplification. It's putting normal forces through the knee, but it's just excessive by that heel coming up too early. The second is abnormal force on the knee, that transverse plane, that toe out, as a result of lack of ankle dorsiflexion, which is also you're going to put more stress and strain on the inside part of your knee. So my next post will be about how to correct it or how to improve that ankle dorsiflexion range of motion. Do the test. Let me know, are you tight? Is it different side to side? And let me know what you think. Thank you so much for watching. My name is Dr. Matt Minard, and I'm so passionate about helping you run safer. If you found this video helpful, if you could please subscribe and share it with your friends, I'd be forever grateful. I have shorter form content on my Instagram, Learn to Run, and then the longer stuff here, more lecture based, because I understand we come to different platforms for different reasons. So follow me over on Instagram if you want the short and sweet, and follow me on here if you want the longer breakdowns.